Good morning, and you are watching The Dietitian on a Mission. My name is Janet Calderwood, and I want to welcome you to the show today. Today is going to be a great show. We have Dr. Mary Lewis with us. It's always a pleasure.
Oh, it's so nice to be here.
When you can free up your schedule to be here with us.
Oh, it's my pleasure. I'm glad to be here.
Yes, and she's one of my favorite nurse practitioners of all time, but she's a doctorate of nurse practitioner, among many other things that I can't keep track of. But she has a lot of knowledge about many medical conditions, and we're going to talk about one of those today. You know, what I've started doing is, as we tape these shows, I'm always encouraging people to take notes, because when I have people like you and other health and nutrition experts come on the show, I think that it's such a rich information, and it can be very helpful in guiding their decisions for health and their nutrition choices. So I think that having a piece of paper and a pen to write things down and take notes is a good way of reminding us of what we're learning. Because sometimes I run into people in the market or even wherever I am doing something, and they'll say, "Hey, you're that lady on TV." And if you ever see me out in public, please come up and say hello to me. I really enjoy meeting people that watch the show. But one of the things that I'll ask them is, they'll say, "Hey, I was watching your show," and I'm like, "Well, which show was that?" And sometimes people can't really remember what the show was about, and that saddens me, because I feel that we do really go out of our way to make sure that the subject is well covered, the topic, and that there's relevant information that's useful for them. So this show is dedicated to people like you that are watching. And today we're going to talk about heartburn and GERD, and we're going to learn as much as we can about this, because it does affect so many people. So Dr. Mary Lewis, my first question to you is, let's start with heartburn. What is heartburn? Does it have anything to do with the heart?
It really doesn't. And it's called heartburn because it's a discomfort in the area of the heart.
Okay.
So people think it's a burning, and they call it heartburn. That's been the term for many, many decades, many years.
Many decades, but it actually has nothing to do with the heart. Okay, now, many people suffer from this, correct?
Actually, in the United States, Australia, and Europe, so we all kind of eat alike in all these areas, up to 25% of people report that they've had that acid reflux or GERD or heartburn within the last week.
Okay, so for a quarter of our country, and others like it, people are experiencing something like heartburn and symptoms associated. You said GERD, which you were using, which means gastroesophageal reflux disease. And
right.
What was the other thing that you mentioned? Was that it?
Yeah.
Okay.
And acid reflux.
Acid reflux. Okay, so now let's talk about, what does all of this mean? What is GERD, acid reflux, and what are these symptoms that people experience at least once a week?
First, I liked your comment in the very beginning, Janet, about taking notes, because if somebody...
I'm taking notes
If somebody
myself.
has these symptoms that we're talking about today, they really should discuss it with their doctor.
Okay.
So take a note about their symptom, take a note about what we say, and then discuss it with the doctor, because sometimes these symptoms that we're going to talk about can actually be symptoms of something more serious. So it's not something that we should ignore or think we can take a medicine or something to treat it quickly and then have it come back over and over again. It's something that should be treated, because it can turn into something more dangerous.
Or it could be something dangerous that you don't think is. So either way, so definitely take some good notes, okay? And make sure you can read your own writing, okay?
So gastroesophageal reflux disease has to do with the gastric or stomach, the esophagus that goes into the stomach, and reflux is acid or stomach contents going up. It's not a very pleasant topic.
Okay, so you have a stomach, and then you have a little, so this esophagus is going into the stomach, and then there is at the base of the stomach a sphincter, right?
Right, we call him less.
We call
LES.
him Les, the lower esophageal sphincter. Is that correct?
Exactly.
And that's where the esophagus is connected to the stomach?
Yes.
Okay, like the hip bone's connected to the leg. Okay.
It's sort of a doorway.
It's a doorway. And you mentioned that reflux is actually when the back of the stomach, that content, and remember that's very acidic in nature, it's actually coming up the wrong way.
Right, and it can be painful, and it can come all the way up.
When you say painful, like describe, what would that feel like? A burning or?
It can be a burning, and it's different symptoms for different people,
Okay.
but it can be a burning, it can be burping,
Okay.
and it can be worse after a meal. It can be worse when you're lying down flat, so 2 hours after you go to bed, maybe you're feeling that, it wakes you up. That's reflux. Sometimes we don't feel it. There's something called Barrett's esophagus, which is kind of dangerous because it's actually scarring that's developed along the base of the esophagus. So when the acid does come up, they don't feel it, but underneath that scarring could be cancer.
So it sounds like this acid content that comes up through the base of the esophagus and sort of up towards the mouth, I guess, that acid causes some damage to the lining of the esophagus. Is that correct?
That's right. It
Okay.
causes it to turn red and it's painful, especially if it happens several times a day or several days in a row. It can
Okay.
actually lead to asthma, sinusitis, and people might think that that's what they have. It may be just all night long that acid is coming up into their mouth and irritating their airways, irritating their sinuses, and so it's kind of a sneaky thing to have
Sneaky
happen.
thing. Okay. Now you said that the symptoms for this condition. First, let me ask you a question. What's the difference between heartburn and gastroesophageal reflux disease?
I think heartburn is what the symptoms are of gastroesophageal reflux disease, and we call that GERD.
Okay, we'll use
G-E-R-D, GERD.
GERD.
But remember, if you're having pain in the chest, it could be acid, and it's very similar to angina, which is lack of circulation in the heart. So pretty scary thing. So if you're having that pressure or burning or pain in your chest, don't assume that it's your acid or GERD or just heartburn. It could be your heart. So it's something that's very easily confused even in the medical setting. So if somebody goes into the hospital because they're having chest pain, we assume the worst first. Let's rule out heart
Okay.
disease,
Okay.
and then we can tell the person, no, you
Give them
really
some
just
good
have
news.
acid
Okay,
reflux
good.
or hiatal hernia.
Okay. So hiatal hernias, and is there anything else that could contribute to these symptoms associated with GERD?
So lots of things. It can be things that we eat. It can be things that we do. Hiatal hernia can cause the same symptoms as GERD too. Hiatal hernia is when the esophagus is going, it fits right through the diaphragm right there. And in some people, that'll slide up and down and cause an irritation of the esophagus, which is the same thing that acid reflux does.
Okay.
It causes irritation to the esophagus.
Okay.
So, those symptoms very, very similar. So that has to be figured out. And so what can make it worse is lying down flat. Can you imagine having a nice big turkey dinner on Thanksgiving and then going on the sofa and lying down flat right away?
To watch a football game?
Yeah, maybe a few people do that.
Some people do.
And then all that digestion that's going on is pushing against the diaphragm, maybe pushing on that hernia, and eventually that acid from the digestion that's going on is going to go up into the esophagus. So that's a really common time for people to have acid reflux symptoms.
So, as much as we can, what we're going to try to help you understand is some of these symptoms that, if you experience symptoms that she's discussing, that Dr. Lewis is talking about, some ways to minimize the discomfort, some of the modalities that are utilized to help manage these problems for people, because we do know that it does impact a great deal of our population, 25%. And my first thing would say, okay, so we know never to lay down. And wouldn't you even say that, I mean, really, what activities will sort of cause that to happen or reoccur? I mean, even things like exercising a couple hours after, you know, a meal.
Yes, if you have a full stomach and try to do sit-ups or try to run and bounce, yeah, you're putting pressure on that
Who
poor
wants to do
sphincter.
sit-ups after a meal anyway?
Who knows?
I'm just kidding. We should all be doing those.
Yeah,
okay?
but you're putting pressure on that sphincter.
Okay.
And really, over time, that sphincter gets weak and wrinkly just like the rest of the body. And eventually, you know, it's going to get weak and the acid's going to back up more and more.
Okay.
So the idea is to take care of it as much as you can.
Would you say then, so really with eating, okay, so there are some better times to eat, right? One would be not eating right before bed.
At least wait 3 or 4 hours. Some physicians or providers say 6 hours before you go to bed.
Okay.
So that gets rid of that nighttime snacking, which is probably also good to get rid of. But yeah, if you've got food in your stomach when you are lying down in bed, you're more likely to have acid reflux.
And don't we find too, Dr. Lewis, that even if people can limit the amount of food that they're eating at a given time, that can have a real huge impact on reducing and managing those symptoms?
Yeah, you think about, you know, only fill your stomach up so far, because if you push it too far, then you're more likely to stretch that lower esophageal sphincter. There are also some medications that will relax the sphincter, which we don't want it relaxed. We want the door closed tight.
We want the door closed tight, don't we? We want to keep the acid in the kitchen. Keep it in the stomach where it belongs. Okay, now, so you mentioned, okay, the timing of the meals, the amount of the food. What about, I was going to say, people that wear really tight pants? Does that
Well, that's an
affect?
interesting topic. Sure, if you're always wearing pants that are just too tight, you're pushing on that stomach, and food can
It
push
really
up.
can impact your acid reflux. I was reading a very interesting article that talked about, you know, that's why, remember those pants, they're called Sansabelt, like men used to wear them. I think some still do. And they have like an adjustable waist, and like you put it here before you eat, and then after you eat, you have to like make it, it's elastic, so you can expand it according to how much you eat. But again, I think limiting the amount of food that people are eating at a given meal time, unless of course you don't mind suffering with some of the consequences associated with reflux after your large Thanksgiving meal. Just be mindful that if you are going to lay down after you eat the meal when you're sitting on the couch watching football, that you should probably put several pillows behind your back to keep you in a somewhat upright position to prevent that from completely going back down, right?
Right, and also having a normal weight, carrying a normal weight. If you're a person who carries a lot of weight in the belly, then that's also putting more pressure when you lie down on the chest, the diaphragm, and the sphincter.
What percentage, you mentioned weight, would you say that there's a huge correlation between obesity and GERD?
Yeah, it's one of the major causes of GERD.
So obesity. And then and you mentioned that you don't want to stretch out the sphincter. What causes that to happen?
Lots of things can, and constant reflux will keep that door open all the time. Certain foods that you're eating are going to cause it to be irritated and open it up, and that might be things like carbonated or other gassy foods, chocolate, coffee, tea.
So caffeine-containing
yeah.
foods, gassy foods,
High-fat foods.
high-fat foods. French fries is included in
Oh,
that.
probably French fries,
And
some spicy foods.
Fried chicken, spicy food. So
Yeah.
anything like that will actually cause that sphincter to.
It'll cause it to be irritated.
Irritated.
And may loosen it up. And just
So
over
that would
time-
be good for starters. Number one, don't wear too tight of clothes. Don't eat meals that are way too big, and limiting the intake of caffeine-containing foods. And is that why you put chocolate in that category?
Yes.
Because there's not a whole lot of chocolate or a lot of caffeine in chocolate, but I'm a chocolate lover, so I have to say this and advocate for chocolate lovers everywhere that really just a little bit would probably be okay, but being mindful, of course, that some of these spicy foods and acidic foods and caffeine-containing foods can exacerbate these symptoms, it sounds like.
Yeah.
Even things like peppermint.
Even
right?
peppermint.
I mean,
yeah.
even though we know peppermint is good to settle your stomach, right?
Too much of a good thing may not be good.
I heard that because it's so strong, that it can actually affect a person's, it can cause some discomfort.
Kind of a cool burn.
A cool burn. Okay, so that's how we'll describe it. What about people that drink heavily, like not alcoholic beverages? I'm just talking a lot of fluid with their meals. What kind of pressure does that put on?
Fluid kind of moves on through.
It
so
does.
Fluid is okay. Now, it's better to drink after or before a meal and not with, I understand, but I think fluid kind of moves through.
Okay, so, if you're going to drink a gallon of water, it might be best to not do it with the meal, but just a little bit. Because again, remember the volume that you have in your stomach and everything, and even though some things move quicker through the digestive tract than others, that, it's that added amount of volume that could cause, some of the reflux content to come back up and cause the symptoms, okay? All right, so we've identified some certain things that can cause these symptoms. You mentioned sometimes people that have hiatal hernias, and even sometimes with people that have gastroparesis or slowed gastric emptying, that can also cause some reflux problems. So be mindful of that, I think, is the key here, so that you know that you can do something about it.
Right, yeah. Gastroparesis is another problem, and also a reason to go to the doctor if you're having those symptoms, because that just means that your GI tract moves very slowly.
Let me ask you this. I'm just throwing this out there. So people that have bulimia or an eating disorder, and I'm throwing this question, she didn't know I was going to throw this. This is kind of one of those, out of left field questions, but what, if somebody's repeatedly vomiting, right, and I mean, they're throwing up their food, that cannot be good for...
It's awful, and I've seen horrible consequences in those sad situations. That somebody will eat 4 or 5 whole large pizzas at one time. That's what bulimia is, eating that much. I can't even imagine eating more than 2 pieces. 2 is a lot.
And then they vomit so that they don't have the calories, right?
And then they vomit to avoid absorbing the calories, but the acid is coming up too, and they burn their esophagus. And
so that's kind of the same thing, right?
Oh, that can become a terminal condition. And having an esophagectomy, having your esophagus removed because of that, I mean, it's just horrible.
They're going to need a feeding tube?
Yes.
Okay.
Yeah.
Well, we don't want anybody to go through that. That's a very serious disease. I know people that have that condition, and it's really unfortunate.
Yep.
But, you can only handle so much food, and, and that's an eating disorder. So if you have that problem, the best suggestion we can encourage you is to get help for it, because you're not doing yourself any favors, and it gets worse, but it will never go away. It will get worse and worse and worse. Okay. And I just had to throw that out there because I think it's important. All right. What about, okay, so we talked a little bit about these symptoms. Now, what would your first suggestion be to somebody that feels like maybe, hey, you know what, I've got a little bit of a, maybe I'm regurgitating food, or maybe there's a little burning after I've eaten. What do you do next? You go to the health food store and ask them for something for that to fix you, or what?
The interesting thing is something works for one person and it doesn't work for another. And the next thing is to choose the simplest medication first or treatment first. So the first thing would probably just be to just try some water. See if you've just got a little acid, you can swallow it down and push it back down where it belongs. So drinking some water. If that doesn't work, then you could try something that will be soothing to the esophagus, and that might be something like Tums. And we have some Tums here. There are side effects to everything that we would try though, and Tums is calcium. And so that causes constipation. There's good and bad things about Tums. So you might try that, 1 or 2 Tums, and see if that doesn't neutralize the acid that's already there.
And they have chewable, and you just chew that up. And
they're tasty. These are fruit flavored ones that I brought today.
Oh, I want one. Let me have one. I'm going to have one. Okay, I'll try it out and let you know how that tastes. Okay, so Tums is one, and
now, one thing I'd like to just kind of caution everybody about is Pepto-Bismol. That's something that my parents gave me, and we probably give our kids now and then to settle their
I know
stomach.
somebody that has a car that color.
Oh, it's a very pretty color, but there's aspirin in it. So aspirin is irritating to the stomach. So you can try the Pepto-Bismol. It might help reduce fever and body aches, and it might settle the stomach, but just remember and use it if it's helpful, but it does have aspirin in it. So if you do have an ulcer, you don't know you have an ulcer and you've got an ulcer, that's going to make it worse.
Or if you're on a blood thinner and your aspirin acts as a anticoagulant, just like a blood thinner does. These are pretty good, by the way.
See? Yeah, almost like candy.
Dangerous, though. I mean, you could eat these things for candy.
And too much calcium causes constipation.
I
so
OD'd on Tums because I had a sweet tooth. Can you imagine? Okay, so you said you know, sometimes doing the least thing first, like drinking the water or whatever, may help you just to alleviate the symptoms. Even some of the dietary things that we talked about, you know, avoiding some of those types of foods may actually help minimize some of the discomfort that someone is experiencing. Sitting up right after they eat, instead of laying down and trying to do some sit-ups. Okay, what else?
Okay, so then if the Tums aren't really doing it, or you're really taking the Tums after every meal or every single day, 3 or 4 days a week, that's a little bit much, and maybe you want something that's a little bit more longer acting.
Okay.
So then you can go to a simpler version, Zantac or Pepcid. There used to be one called Tagamet. It's still around a little bit, but it's sort of Pepcid and Zantac are a little bit more popular right now. You just take one. You can take one twice a day. And what that does is it turns off some of the acid production. And so you have less acid to begin with, so you don't have the discomfort.
H2 blockers, we call those?
That's called an H2 blocker.
Okay. All right. Now, you're recommending that, of course, with anything, even if it's over the counter, that a person goes back to their physician with these notes that they're taking from today's special viewing opportunity, and they share that they're having these symptoms, and then what does the physician recommend?
Then the physician or provider will say what has helped you and what has not helped you.
And if they say, well, you know, I was thinking about doing this, but I wanted to check with you first.
Yeah. And
that's a good way of getting the doctor on your side there.
That exactly.
Instead of telling them you did your own internet search and this is what you came up with.
That's very good advice. Yes.
Good.
Ask the doctor. Ask the provider what they
They're
think.
the expert.
Yeah.
Okay.
Because at that point, if you're up to the point of taking Tums several times a week, maybe that's the time that it's good to do an ultrasound of the belly or an endoscopy and have a diagnostic procedure done just to make sure you're treating what you think you're treating and you don't really have a heart problem or something else going on. Pancreatic disorder. I mean, it could be a lot of different things.
Okay, so the key is just paying more attention to what's going on.
Yeah, gallbladder, gallstones, all of those, you know, all those organs are sort of in the same area and can contribute to acid production.
So we're talking about H2 blockers. What else do you recommend?
The next one is the proton, Gaviscon is another one like Tums that you can take. there's also milk magnesia and Mylanta that have some magnesium in them, so they don't cause as much constipation, and they sort of coat the esophagus and the stomach. Milk will do the same temporarily, just taking 4 ounces of milk. But then
That's why when, you know, milk neutralizes, the pH of milk is similar to your blood alkalinity, and so that's why when somebody swallows something poisonous, they say usually drink some milk to neutralize the pH. Did you know that? I bet you did, because you guys are smart.
And baking soda also.
Yeah.
That was an old-time treatment for acid reflux. Put some baking soda in water and drink that. That's another neutralizer.
Okay.
So the big guns are really the Nexium, Prevacid, Protonix, and these are proton pump inhibitors. So they will block the enzymes that produce the acid production. So it's going a step back to produce to prevent the production of acid.
Okay.
And these are 1-a-day pills. If you have really severe acid production, you might take 2 a day once in a while. Getting rid of all the acid by overdosing on these is also dangerous, because you need some acid in your stomach to help digest food.
Exactly.
And I've seen people do that, where they take 2 or 4 of these a day. They end up with a permanently blocked acid production, and they have to take acid pills in order to provide the acid. So be careful of that too.
And a lot of nutrients have to be mixed in with the acid contents of the stomach, and you know, sometimes these proton pump inhibitors and these medications, not just them, can interfere with the absorption of key vitamins and minerals, and then we find people on the other end that are having a magnesium deficiency or something else that is also not helpful and can be dangerous.
Well, and I think people are wasting their money on these expensive drugs when they take, let's say they have to take Prevacid, and then they take a couple other, like an antibiotic with it or something, a heart medicine with it. Well, they're taking something that's blocking the absorption of it with the medicine that they want. So you need to separate those out by an hour or 2. So I mean, these
some
are pretty,
of them are pretty expensive.
and these are over the counter. I bought these over the counter. There are prescription strengths of those, but those are something you should take with the provider's at least consult.
And then you mentioned really quickly here, we have 1 minute left. Tell me, when does somebody need to call 911, or when does it seem like it's just something they need to take immediate action for?
If they have severe pain, sudden onset, if they have symptoms of adrenaline response with it, so they're sweating, shaking, having a lot of pain, or not having a lot of pain, they just feel like there's something wrong and they're sweating and shaking, they're having that adrenaline response, they're sweating, that would be important. If there's bleeding, anybody who vomits blood or passes blood, they need to call EMS and get to the hospital right away.
Well, very good information. I want to thank you for being a part of this show today, because again, I appreciate you taking time out of your day to be here with us, and I appreciate you taking time out of your day to learn a few new things, and I'm sure you've written them all down now, and we look forward to seeing you next week right here on CTN 10.